Hi, I'm here with Jodine Chase, and we're going to have a discussion about counseling and the impact of birthing interventions and how it impacts breastfeeding. Welcome, Jodine.
Hi, thank you, Carol. So I am in Canada. I work as a communications professional. I do a lot of work in the realm of infant and maternal health and birthing and breastfeeding support. As a communicator, I have worked with our local midwifery association and with a number of our breastfeeding organizations. So my area of expertise here is in supporting healthcare professionals like you and your team in translating your knowledge into messages and stories really that can help people to understand the significance of that clinical information that you're trying to impart.
Okay, so if you were looking at it from a perspective, what would be some stories that you'd want to share with healthcare professionals on ways that they potentially could help families during the birth process or even during pregnancy that will decrease any risks associated with possibly negative breastfeeding outcomes or that could potentially impact breastfeeding?
So I think an area that's really important that I know is on the minds of a lot of people right now, especially with COVID-19 and this increased pressure and focus on separating, sometimes recommending or encouraging the separation of the birthing parent from the infant right at birth. I think that that separation piece is really an underlying issue when we talk about birth interventions and the negative impact that interventions are known to have on breastfeeding initiation and duration. So successful breastfeeding is often negatively impacted and sometimes ends because of birth interventions. And of course, we know that our intervention rates are quite high, especially in our Western culture or Western world. But we also know, of course, that sometimes interventions are unavoidable. So in thinking about what can happen within that relationship between the healthcare provider and the birthing family, prenatally, I think it's critical to be having conversations about how the birth will go and what the expectation is and what the hopes and dreams are for a happy and healthy and positive birth. And I think it's also important, and this is where counseling skills really come in, even beyond education and knowledge, imparting knowledge. It's being able to counsel and support families to envision for themselves what it might be like if the birth doesn't go as planned. And so that information about why interventions cause problems for breastfeeding is important information. And it might not really resonate if what you do is talk about, well, the C-section rate is this percent, and this number of people who have C-sections go on to have, challenges with breastfeeding. What might be more helpful is to explain why those interventions interfere. And I think the simplicity of discussing the importance of keeping mother and baby together, keeping the diet together, reducing separation, that's inherently where you're going to get through to people and help them to understand. So within my own experience, I actually have a personal experience that has really helped me to understand this piece. And that is understanding through my own daughter-in-law's birth, my second grandbaby. So I was not in the room when she was born. I was outside in the playground with the first grandbaby. And I came in about 4 minutes after my second granddaughter was born. And the midwife at that birth, coincidentally, was also the midwife who caught my son. So this is a midwife I knew well, and I understood, I felt that my grandchild and my daughter-in-law were in really good hands. What I wasn't prepared for was this midwife had two birthing clients at the same time. So she caught my granddaughter and then immediately went to attend to the other birthing person. And so the other folks on the labor and delivery team stepped in and managed the rest of the birth. And when I arrived, it was 4 minutes after my granddaughter had been born. She'd already had the cord clamped and cut. She had been washed, weighed, measured, and swaddled and given back to my to my daughter-in-law. So I was so surprised because I knew that the skin-to-skin practice that this midwife did wasn't in place in this facility. And it caused me to really start to think more about how much of a team effort is needed and how much support families need to advocate for themselves, and how important that whole piece is. So one particular practitioner can't really necessarily have the kind of impact they want to have if they're only focused on their own practice.
Yeah.
And in conversation with an obstetrician, this particular obstetrician told me his solution to this, and his solution to this problem of not always having, control over what happens, in terms of interventions in that labor and delivery room. He said that he always writes an order for his patients that for delayed cord clamping, for full delayed cord clamping until the cord stops pulsing. And he said, that automatically takes care of the immediate skin to skin after birth, because the baby has to stay there on the mother's abdomen. You can't separate the dyad if the umbilical cord hasn't been cut yet.
No, and so they can't bath the baby. They can't do anything else.
No. But it really, to me, I thought that was, and this really illustrates the power story too, because yes. I am not a clinician, but I do use that story often when I'm talking to healthcare professionals as a way of empowering them to take steps to really protect that skin-to-skin relationship as a way of ensuring that you're not increasing the risk of harm to the dyad. When an intervention has occurred, if you can protect that skin-to-skin piece, or if you can take seriously that red flag that skin-to-skin did not happen, or early initiation of breastfeeding did not happen, and take seriously and support that dyad through the necessary additional supports they need for breastfeeding, you are reducing the potential for reproductive cancers in that mother later in life. You are reducing the potential for illness in that infant. You're having a positive impact on the trajectory of lives and potential. And I think that in a modern obstetrics, our birthing care providers don't always see how impactful it is for them to support that breastfeeding piece.
Yeah, thank you so much, Jodine. I really, the sharing of the stories are so essential, and I think your stories are going to be very impactful to the people that are listening to this presentation. So thank you again so much.
Well, thank you for having me, Carol.